All right, welcome back everybody to the Dose Adjustment Podcast. So today we are going to get in the topic of how to select the correct primary care provider.
Well, and it's continuity of care. Men don't want to hear what's wrong with them, and we're kind of we get into a denial thing, and it's men of a certain age too.
Yeah,
because we're in denial about our own health, because this is human life, human body, and quality of life. It has to be a very real and frank conversation.
The information provided in this podcast is for educational and informational purposes only, and it does not establish a physician-patient or pharmacist-patient relationship. The opinions expressed by the hosts and guests are their own and do not constitute medical advice. This content is not intended to diagnose, treat, cure, or prevent any medical condition. Always consult with a licensed healthcare provider in your area before making any changes to your personal healthcare regimen or acting on any medical information shared in this podcast.
All right, welcome back everybody to the Dose Adjustment Podcast. My name is Amir Rahimi, my co-host Kris Hasenauer. Welcome back, Kris.
Yeah, welcome.
Awesome, brother. So today we are going to get in the topic of how to select the correct primary care provider. I think this will be a very interesting topic, whether you currently have a PCP or you're somebody who knows in the back of your mind you need to get one.
Yep.
But before we jump into that, scrolling the internet this morning, and taking a look at this new idea of reducing or inhibiting rather individuals from using their SNAP benefits or their, I think we used to call them food stamps, like right back in the day, to buy junk food, candy, Doritos, Cheetos. And there is a certain group of people who are losing their mind over this, right? Yep. And the idea is, should people be able to take, they call it government money, right? But taxpayer money, my money, your money, right? And should they be able to take that money, give it to somebody else, and then allow them to buy foods that we as healthcare professionals know are harming them and furthering chronic disease? And so, the administration will say, well, we don't allow people to buy cigarettes. We don't allow them to buy alcohol. We don't allow them to buy illicit drugs, right, with taxpayer money.
Yep.
So why should we let them buy junk food that's further harming them? Right. But there is a segment of the population who is losing their crap, calling people everything from racist to saying we have no right to tell people what to do. This is a free country. And so I want to open it up. I want to get your opinion on this. I kind of know where I fall with my tax dollars, but what are your thoughts?
Okay. So my thoughts on it are basically on the same line as you, but I will go back to my same thing with the military. Military does the same thing. Like, you look at that, and the military lays it out. It's like, all right, taxpayer dollars are paying for this. Here's your meat, your vegetables, your salad. Go forth, do PT, do things. Like, it is not, they are trying to do the things that are going to make you the most optimal war fighter you can be. I'm not saying that people that are on government assistance are going to go do that, but I mean, at the same time, why would we feed into the chronic health epidemic to say, all right, we know that we're going to have to treat you with Medicare, Medicaid for diabetes or chronic disease. No, it's a self-licking ice cream cone.
100%, and that's it, right? So taxpayers, right, are going to, like you said, they're going to pay for the chronic disease treatment, which is going to cost for an individual potentially hundreds of thousands of dollars to the taxpayer. Meanwhile, preceding that, we're allowing them to take taxpayer benefits and buy the food that's causing the disease. It seems like a no-brainer to me whatsoever, but everything right now coming out of the administration and where we're trying to move the country health-wise seems to be controversial. Is it just political, or is there, I can't understand it.
Money.
Money.
It's always money. I 100% believe that. Everything I see is who's getting paid.
Right.
Who's making money. I mean, there's that viral video about the guy that was buying Jameson with his SNAP benefits. Did you see that? At Publix?
Yep.
The guy, you guys, this is how you do it. He bought a bunch of food and then went over to customer service. He got a gift card, then went into the Publix liquor store and bought a bottle of Jameson.
That's the way to do it, I guess. And I understand it from a vendor perspective, right? So I run multiple retail businesses. Of course, at the end of the day, we want to sell product. I'm a little bit different in that we're a healthcare organization that also sells product. And when I took stores over, we had a tremendous amount of candy, Snickers bars, Reese's, sodas, and not that we've completely eliminated them. And we're not talking about that people shouldn't have the freedom to eat these things. We're talking about should people be able to utilize tax dollars
to do that.
Do that, right? So I do think that people should be able to, on occasion, or whenever they want, because it is a free country, enjoy what you want. We could debate whether it's the best thing for you or if it's optimal for you. But I understand the vendor side, right? People are just trying to make a living, right? So they can pay their taxes, right? So they can fund, all these programs, so to speak. So
yeah, again, I think it's one of those things you follow the money and you see where it goes. Like but no, like there's no reason, like no pediatrician, no dietitians be like, yes, of course your 3-year-old should have,
Twinkies, Cheetos, whatever it might be.
As your staple of your diet. Like, and we can make healthy food cheap in this country. It can be done.
Absolutely.
Like shitty food does not have to be the cheap choice.
Yep. No, I agree.
That's the bottom line.
All right. So that's our official opinion. No more SNAP benefits for Doritos, Cheetos, and lollipops. All right. Moving on. Today, we want to talk about practical ways to help men and really all humans. How do you pick the proper PCP or primary care provider? We're going to kind of define what that is, why they are so crucial as a healthcare partner in your life to be optimal in all things, as well as what might be red flags. When I don't want to say interviewing. I'm going to get into the interviewing because I'll see if it's something you do, but what might be red flags with your current PCP. So with that said, statistics will show that about 60% of men do not have a primary care provider.
100%.
Right? So there's 3 of us in this room. I happen to know that all 3 of us do have a primary care provider. We stand very close. Well, shoot, there you go. There you go. So, what do I know? But at the end of the day, a lot of people they'll start looking for a PCP like in an emergency, right? And so that's kind of how, I'd run into you, so to speak. I had terrible gout in my foot. I am not established with any doctor. If I want to get a PCP visit here in the great state of Florida, you could be waiting for 2 months, 3 months. I could go to urgent care, but the quality of care at urgent care is it's dicey at best.
Well, and it's continuity of care.
Correct.
Right? And that's the weird thing about it. So the last time I looked this up, the average primary care provider in Florida right now has between 5,000 and 7,500 patients.
Crazy.
Per provider. That's an MD level provider. They think that the average PA nurse practitioner was between 3,500 and 5,000.
So the practice or the individual provider?
The individual's patient census.
Okay. Right.
Like that, like that's how many, which is crazy. You can't, like, you're not seeing people so. Primary care, what is that ultimately, right? That is your medical professional that has a generalist knowledge of medicine, right? So a generalist knowledge of medicine means a functional amount to treat conditions for the whole human body and recognize the point where it needs to go to a specialist, right?
Right.
And the other thing that your primary care needs to do for you is deconflict with your specialist on the stuff that you're doing, right? So if you go to your cardiologist and you're on this, and this, but your kidney doctor's like, you're on this, and this, and your endo doctor's this, and some of those medicines don't add up, and that's kind of where your primary care and your pharmacist come in. So you're like, hey, we've got to deconflict this. Now, because you can be taking one thing to treat a disease or condition that is hurting another condition, and you have to weigh those things out. I mean, there's cost-benefit analysis to everything you're doing, but that's what it should be, and your primary care should explain it to you in layman's terms so that you understand it. I mean, we have so many doctors that they come in and just listen to me because I'm a doctor, or listen to me because I'm a PA, or whatever. This is what I told you to do. It's like, no, ask questions.
Yeah.
If you don't understand it, be like, yo, I don't understand what you're saying. Please break that down for me so that I know what's wrong.
Yeah, 100% agree, and I think those times are kind of fading. I'll say, where you just go in and you just, carte blanche, trust your doctor no matter what. With the invention of Google, it's like, man, you better bring something different or a different perspective, or make me feel comfortable with your experience, that something unique about me, because and I see it every day at the pharmacy. People aren't actually taking a lot of the advice that their medical provider is giving them.
Yep.
They feel like they were rushed. They came in, they came out, they didn't get the attention they deserved, and they feel like the doctor may have misdiagnosed. The doctor was so, doctor or PA or whatever it might have been, was so confident, right? We would say cocky would be another word, that they knew what it was before they even laid hands on them or looked at lab work. So finding somebody who can show that genuine interest.
Well, there's a huge component to patient interaction, right? And the biggest component is talking to your patient.
Sure.
Right? Labs are a snapshot in time of what was in your blood in the second that tube came out of your body.
Yep.
That is all it is, right? So trended labs matter and understand. So like that's where your primary care comes in, right? Oh, okay, I'm going to draw labs on you every 3 months to see what this is doing.
Yeah.
So we can interpret the results, not just, okay, here we are. Nice.
So 60% of men do not go to a PCP for an
No.
annual checkup.
No,
Why?
because men do not like hearing shit that's wrong with them, right?
Okay.
Like we are all like all of us in denial.
Guilty.
Guilty.
Yeah.
I'm guilty as charged, right? I am the PCP, and like I will say Dr. Augusta is my PCP, but have we sat down and done a full like, hey, I need to work up and talk? Like, maybe once in the last 2 years, where I've actually
we should get that scheduled, maybe.
Yeah, we should probably get that scheduled, right? Like, gotta drink your own Kool-Aid a little bit, right? But
yeah.
it is those things, and men don't want to hear what's wrong with them, and we're kind of we get into a denial thing, and it's men of a certain age too.
Yeah.
Because we're in denial about our own health. Because okay, you're in your 20s, your 30s, you're pretty bulletproof. You hit about 35, 36, and then you sneeze wrong and throw your back out.
Yeah.
Right?
Yeah.
Like,
Been there.
So
Been there.
so then what do we do there? And then you come talk and say, all right, well, you've got this and this. You can get ahead of it now. You're going towards metabolic syndrome. Your cardiovascular health is not the best. Because what else do we do as men? We continue to eat like we're in our 20s.
Yep.
Like, Ed, we can't do that. Your body just doesn't it's going to
Doesn't
reject
process
it.
Yep.
Yeah.
100% agree. Well, so there's lots of different types of primary care providers, right? So things like MDs, DOs, NPs, PAs. Can you break those down for me a little bit? And like,
Yes.
if you're listening to this, like, who is credible, who is not credible? Are they all credible? Give me a scoop.
Okay. Multiple pathways to be involved in medicine. MD, medical doctor, right? Like they're going to go, that's your guy that went to an allopathic medical school, finished a residency, and are in primary care of some, have kind of decided that primary care family medicine is their specialty, or they're an internist or something like that typically. Sometimes you'll have the occasional ER doctor that's kind of transferred out of the ER and done it too, but they are that same kind of thing, a generalist in medicine, understanding the human body from, from pediatrics. Pediatrics are kind of generalists in what they do, but all of those things. So that's where they do. That's your MD, right?
MD, okay.
Right? DO, Doctor of Osteopathic Medicine, is another route for a doctoral degree in medicine. They have a kind of a mix between allopathic med school medicine and chiropractic.
Okay.
They do some chiropractic adjustment and in their training, and they do that.
I was going to say it's something more about the physical
It is. And
touch and manipulation and whatnot.
Then they add some manipulation to it. Now, they can go to a residency, and then some of them don't really use that much because they end up doing the medical training. Like there's a lot of DOs in emergency medicine. They don't do a lot of adjustment in emergency medicine. Right. So, but same concept.
Credible.
Cool. Right. Multiple schools. Physician assistant, physician associate, as they're trying to recoin the term because people are pissy about it for whatever reason.
Does associate sound better than assistant?
I personally don't give a shit. At all. Like
I think PA sounds the best, right?
Whatever. It is what it is.
Yeah.
But so what is that? It is an initial master's degree in medicine. There are doctoral follow-on programs for it, but initially it is a master's degree in medicine that allows you to work, and then you get a lot of on-the-job training from the doctors you go work with.
Work under.
So my initial training out of school, I went into an ER residency program, and then I worked in the ER, and then I did some military medicine stuff. So like my initial stuff was emergency medicine based.
Okay.
And then it kind of transitioned back into the primary care side of it. But like PAs can go get hired by any doctor or DO, there's cardiology PAs, dermatology PAs, and then they take their follow-on training on the job under the advisement of the supervising physician.
Right. And these PAs are on fire right now. I work with a lot of them, across, this part of the state and whatnot. And they are extremely knowledgeable. As I was kind of in my, over the past 10 years, like learning all these different specialties and who can do what and the difference between nurse practitioners and ARNP, am I saying it right? Or APRN, I always mix it up. I'm a little dyslexic. But the PAs right now, they're seeing a lot of patients. They're treating a lot of patients. I've been just really, I guess, impressed by their knowledge base. I think they're fresh, right? Like, I don't know if they're fresh out of school, but their knowledge base seems to be on par with the DOs and the MDs.
And absolutely. And I think a lot of that comes from a lot of them are right out of school. It's just like anything else. Like medicine is continually evolving. How do you stay relevant? And you have to continue to do CMEs and educate yourself because it's always changing. Nurse practitioners started as another master's degree. So as a typical pathway is you have to be a nurse RN first or BSN first, have a little experience, then you can go to a nurse practitioner program. They can be autonomous practice autonomously in the state of Florida after a certain point, and then depends if it's a master's or doctorate level program that they went to.
Yeah, right on. I'll say, for myself personally, and I think a lot of guys our age are like this. We're hard charging, maybe entrepreneurs, maybe just successful in the companies that we work for, but we're going 14, 15 hours a day. I know that I own 3 or 4 businesses. I know you own 3 or 4 or more businesses. We're trying to be there for our family, for every event and tournament. We're trying to make it to the gym. We're trying to sleep a little bit. And for me personally, like I, for years, avoided even getting a PCP until I had a problem. But I think our message here is get a PCP, get them early, get them before there's a problem. So then when something goes wrong, they already have that background, on you. They have that relationship. It's very easy for them to go in and say, here's what I think we ought to do.
Right. Absolutely. I mean, guys will shop to trust their mechanic more than they'll figure out their doctor. Like they always like, oh, this is my mechanic. Guys, like, why don't you have the same relationship with your doctor? Like that's the mechanic for your body.
Yeah, 100% right. And we're all trying to go 100,000 miles, right? But we don't have a mechanic when it comes to our body. So, to everybody out there who's the same way, hard charging all day, GSD mentality, take the time, book it. Get a PCP is extremely important. And we'll talk about quality PCP here in the upcoming time, but take the time and just get it done. That's the recommendation.
Absolutely. If you're in Florida or Vero Beach, Treasure Coast area, you want to come see me, you can come see us at Emerald Medical. And so there's that. I mean, we're taking new patients. There's there's popping up more and more. I mean, there is absolutely a need. If you're in a place where you call and they say, oh, we can't see you for 6 months, make a few more phone calls.
Yeah, 100%.
Like there's places that have availability.
For sure. All right, so let's go into and this is a concept, and I don't know, do you allow patients to do any sort of interview or get to know you, or how does that work? If they call, let's say your practice, and say, hey, I'm thinking about coming up here and being a patient, how do they know that PCP is quality or not?
I think. You can look at there's Google reviews and all the things. There's typically like ZocDoc, and there's some good things out there. You can look up anybody's medical license. You can see their complaint history on the state. I mean, this is a pharmacy. You can look those things up. That's public record. I think that it absolutely matters if you can have a working relationship with that person. It is a two-way street. You have to be able to communicate with who that is. I am 100% aware that I am not the primary care for everybody.
Right.
Because I am very blunt, right? Like very blunt. And there's people like, even my office staff will prep people with that. Like there's actually hey, you need to understand, like he does not sugarcoat a damn thing. Yeah. There's like, we will help you, but we're going to have a very frank conversation about what it is, how you got what we're trying to do and why we're trying to do it.
Yeah, and I appreciate that, and I think about you, and we share some multiple patients, right? And sometimes I'm saying, hey, I just talked to this patient, here's kind of what's going on, and I ask you, I'm like, hey, can you just be real with this guy? Because I'm being real with him, and if you're real with him, then maybe we can move the needle on this guy to a place of better health.
Absolutely, and it's, and I have actually had it where I've had to fire patients. Right. Same way, and I've had patients that won't come back and see me because there has to be a give and take. Now the goal is, again, medicine. Do no further harm. first and foremost, do no harm, right? Well, that does not mean don't get sued, always agree, and just tell the patient what they want to hear. That's not what that means. So we have to be, this is human life, human body, and quality of life. It has to be a very real and frank conversation.
Yep.
And that's just what it is. So yeah, absolutely. I mean, I love talking to my patients. Like usually my typical new patient encounter is about an hour. They schedule an hour for any new patient that I get.
It comes in, yeah.
It comes in because take the history, we talk, and I do a pretty long interview process of myself just the first time when we're talking to them because I want to know everything. Like, oh, I did this and this and this, and like these are contributing factors to X, Y, Z. Because in my practice, we also do behavioral health. So we're doing a whole person evaluation when they're coming in there.
Right on. Give me 2 or 3 things that a good PCP will catch. Let's create a hypothetical patient. Let's say he's 42 and handsome like me, right? But doesn't have a PCP. Comes in for the first time. Has not been under care. Has not maybe managed glucose levels, hypertension. Has no idea if he has cardiovascular risk. What's 3 good things like a typical PCP will catch that's often missed by the individual?
Okay. I mean, those are your silent killer things, right? What do you got? Metabolic syndrome, diabetes. Are you trending that way? Is your, again, diet, exercise, supplementation, like what are you doing for that first and foremost? And then have you get that A1C creep up, your fasted glucose is like 105, just barely high. You're like, oh, I had a little coffee. You're like, okay, we're going to watch that a little bit. Mm-hmm. Your thyroid. I'm getting a little more fatigued. I'm doing this. We'll look at some hormones. We'll look at some other stuff like your cardiovascular risk. And like, as I'm very big on, all right, your cholesterol's up here. We're going to do 3 months. And I'll give them a diet and exercise plans. Like, here's what I want you to eat. Here's this, and it's like everything else. All right, I want you to do this, this, and this. I'm like, well, I don't like the XYZ. It's like, then chat GPT what you like in a version of this diet. It's available. It's a tool. Like use the stuff that's available to you to make a version of food that you will eat that complies with these standards.
Right. Yeah. No sugar.
No. Yeah. You got
seed oils.
Those kind of things. There is improvement with all of that. Like, I mean, I think my diet right now basically consists of cottage cheese, Greek yogurt, berries, meat and vegetables.
Yeah.
Like it's just
simple.
Is where it's gotten to. I get obviously monsters and I have an addiction to caffeine. Full point blank. I'm about a pot of coffee a day plus energy drinks. Like it is the fuel that keeps me going.
My name is Kris. I'm addicted to caffeine.
I'm addicted to caffeine, but
fair enough.
That stuff works, and it's great in the gym. It's great, all those things. So I think your metabolic syndrome, your cholesterol, and evaluating your thyroid are 3 good baselines for guys our age.
Okay. Tell me about some red flags. Let's say, speak to those guys. They've already got a primary care provider. They landed there somehow, whether it was somebody who was assigned to them by their workplace. It's more common now. Mm-hmm. What are some red flags that they should be looking out for that maybe the provider isn't giving them the time and attention they really deserve to be the best and healthiest version of themselves?
If you bring up a complaint and it gets blown off, or you bring it up and you get we'll treat it next time.
Okay.
Right? We'll talk about that next time because that's where it's we'll just get you back in for another appointment.
Yeah.
Kind of thing. I mean, I had a crazy one with my dad. He went to a doctor for a mole removal a few years ago. They sent him home with the wound open so that they could rebill him the next day to suture it closed.
Follow the money.
Follow the money.
Follow the money.
So like, if you feel like you're being rushed through for money, go check somewhere else. Now, again, it's a business, but there's other pieces with it. If they're not talking to you about all the aspects of health, if they're like, oh, you have cholesterol, here's your medicine.
Yeah.
If they're not talking about your diet and giving you advice, and again, we live in the age of information and access. If you have a question, backstop it, check the answers.
Yeah, 100%.
Because regardless, we're all still human beings. We're not infallible. We do make mistakes. That is 100% just how it works. That's why we have colleague relationships. That's why you check the prescriptions I send in to make sure, and hell, we've even had that. I mean, I've sent somebody like, did you mean to prescribe this? I was like, absolutely did not. Thank you for catching that. So like that's happened multiple times. So, I mean, we do those things. You're a human being, but you have to get your needs met. So if you feel like something's not working for you, ask more questions or go somewhere else.
Right on. So this one here is probably a little controversial, right? But if you go into your primary care provider and they look deathly sick and diabetic and inflamed throughout the body, is the credibility there or not? What's your thoughts? This one's gonna be controversial. I know we're gonna make some people upset.
Or like,
I'm sorry. This is how I gauge things.
No, I do. I do too. I mean, I'm very much try to practice what you preach.
Yeah.
I absolutely agree with that. I think it's like,
I'm not talking about perfection and abs,
just-
but I mean like, I've gone to some, and again, back to my minute clinic, experience type things. And these guys, they just are in terrible condition for their age, right? Terrible condition, and I'll listen to them give advice to my mom or my dad, because luckily I tend to just be there with them typically when they go to those situations, and like, bro, you were not practicing what you preach whatsoever,
and I mean, I think that's everything. I mean, you're how do you sell it? But where, it also comes back to like, just like you said, who's doing that? Who's working there? Where are you going?
Yeah.
Like, here's my other red flag with primary care. If your primary care immediately refers you out for everything that they find.
Pass the buck.
Pass the buck. Like, oh, your thyroid's off. Go see the endocrinologist. It's like, well, why don't you just put them on some Synthroid and see if we can balance that? Like, none of this, like, if it's a first line medical thing and they're immediately like, go refer.
Is it a lack of knowledge that they're doing that, or is it a pass the buck, just pass the work off? Like, why do you think, or is it cover, CYA?
I think it's a little bit of everything. I think it kind of goes back to, but if it's a big healthcare system, right? Like if you're going to go to like a whatever, I'm going to pick whatever giant healthcare system you want to think about, and the primary care providers in that healthcare system.
So it's referral within the system too?
Referral within the system, right? So like a primary care appointment with me, typically $150 to $225 per visit. A specialist, $350 to $550.
Right.
So, oh yeah, you need to go see this guy, and then we can bill your insurance. The company can bill your insurance $350 instead of $150.
I would love to be a fly on the wall at some of the high-level administration meetings for these big healthcare systems, because I've sat at them at large corporations, right? The Walgreens Corporation, right? And at the end of the day, of course, things are about compliance, right, and not getting sued, but follow the money.
Follow the money.
Everything we did around those meetings was around driving the things that drove profitability while maintaining compliance and not getting sued, right? And then accomplishing, of course, their DE&I goals of the Walgreens company. But it was always money, money, money. So it'd be interesting to see these big healthcare systems if they are self-referring.
Well, they absolutely are. I mean, HCA was an insurance company.
Yeah.
And then they just started buying hospitals. So now you own the insurance, you own the system, so you're all of that stuff. I mean, transparency and pricing with healthcare.
Yeah.
Like why don't we have that? Why can't we post the price list like freaking Meineke or whatever?
Yep.
Okay, this is how much it is to do X, Y, and Z.
I say that to Emily all the time. In the pharmacy business, currently insurance companies are very non-favorable towards your community pharmacies. They'll pay us on the order of 22 cents, 26 cents to fill prescriptions, which is an absolute shame. And the same thing I'm telling her, like, what if we just had a fair price? Like, what if the prescription was just $8, right? You wouldn't even need the insurance company. It's just $8, right? Or $12 for 90 days.
Yep.
It is a fair price. I can afford to pay somebody to come in, review the drug interactions, afford to buy the bottle, which costs $0.25, by the way, afford to keep the lights on in the building, have all the insurance, just transparency.
Well, it is, but again, like I said, we use health insurance like comparatively if we used our car insurance to get our tires rotated.
Yeah.
We don't do preventative maintenance. We do sick care. And that's a very large business model.
Indeed. All right, we're going to fix that on the next episode. But, all right, so if you're a guy or a gal going to a primary care visit, give me the 4 or 5 things that you need to bring with you to make sure that it's the most productive first conversation. Or if you just haven't brought them in the past, what should you bring to your next visit?
Oh, well, you definitely want to get any medical records that you have. To say, if you have a significant medical history and you have records, bring the records. Obviously, ID, insurance card if you got it, and just bring an open mind to answer the questions honestly, because they're going to ask you some questions just in the medical intakes. Some of them may be embarrassing. Some of them may be, but don't lie to your doctor.
Yeah.
They, that's what HIPAA laws are for, the confidentiality laws, all those different things. Don't lie to your doctor because, okay, for example, the guy that's like, oh, I drink 1 to 2 beers a week, that's really drinking 8 to 10 a day.
Yeah.
And they're like, oh, I need to take this med. Well, taking this with alcohol is not good. You know, like these different, just something as simple as that.
Yeah.
Like those things matter. So when you find them, because you're going to get asked those questions, find somebody you trust. If you can't get an appointment or you don't like it, look for another place.
Yeah.
You're not stuck there.
And when you're dialed in with the right provider, they are there to help you live the healthiest, most productive, best life for you, right?
Yeah.
So going back to the being honest thing, like they're not going to judge you.
They're not going to judge you, but they might call you on your bullshit. And
Yeah.
people don't like that.
100%.
So if that's the case, and because that you cannot treat the patient without the information. And the patient is the source of the information because it's your body. So explain to us what's going on, be honest about it, and let's work a pathway to fix it.
Yeah, and we talked about this a little bit in episode 2 when we were talking about sexual health and wellness. Like, it seems like even in this day and age, guys are still timid to talk about it or bring it up to another man. Or if they have a female PCP, right? I could see that being potentially a little bit embarrassing. But there's a tremendous amount of treatment options that can allow you to go back and enjoy the life that you want to enjoy, whether you're a man or a woman. I think it's one example of many,
Absolutely.
but a powerful one.
But the end state goal is, what is quality of life?
Yeah.
That is the whole goal. Quality of life. Human performance for that human.
100% agree. All right. Well, here's the deal. We really, really want to encourage you here at the Dose Adjustment to get a primary care provider. There are many good ones throughout the country. If you are here in the state of Florida, we can either refer you to somebody who's close to you. We will flash a number up so you can reach out, make an appointment, and or get a referral. If you do not have one, please, we encourage you in the next 6 months, book an appointment, get seen, find a really good PCP. That way you can be the best, healthiest, strongest, longest living version of yourself. I think that's our ultimate goal here, right?
Yeah.
So.
Yeah. Like I said, enjoy your life and then everything that we can do to help you. That's our plan.
Right on. All right, guys, until next time, we're going to episode 5. I think we're deep diving into sleep.
Yep.
I believe is going to be the next episode. So we look forward to talking to you about that. Until next time,
See you later.
have a good day.